Indiana in the morning. It's WCCS 101.1 FM, AM 1160, WCCSradio.com. Dr. Dan Clark joins us this morning as we wrap up a month talking about colorectal cancer. And you might wonder, why so much time on colorectal cancer? Well, it is one of those that we all need to watch out for. And it's also one of those that is very, very common and yet very, very beatable would be the word for it. Our visit this morning presented by Marcus & Mack, voted best law firm and best personal injury lawyer 3 years in a row in the Best of Indiana County contest. Visit them online at marcusandmack.com. It is also colorectal cancer, one of the most deadly cancers if you do not follow through on getting it treated. So it makes it really, really important. And we want to talk with Dr. Clark this morning specifically about advances in genetic research that help us to identify the markers that predict colorectal cancer. And that is a science that you are very much intimately involved with. You are very, very up on that. That's a real breakthrough, isn't it?
Yeah, I mean, we've known about it for breast for a while, and, that's been out in the public with the BRCA gene, and now there's multiple other breast cancer genes. But what people don't realize, there's also a significant genetic connection to colorectal cancer and other cancers too. But there's been a lot of progress with colorectal cancer and in identifying individuals who might be at increased risk because of a familial history of not just colorectal but other cancers too.
Yeah. So how do we incorporate this science into the diagnostic toolbox?
Well, when we look at people who are coming in for screening, for instance, if you have a family member who had colon cancer or rectal cancer less than the age of 50, that should raise antennas of suspicion that there could be a genetic component, because then that should lead to a conversation, have there been any other cancers in the family? Because a lot of the colorectal cancer genes are related to other cancers, specifically like endometrial or uterine cancer. So if you have a family member who has colon cancer and had uterine cancer, that raises a suspicion that maybe we should be looking for a genetic component. There's other cancers that are less common. Biliary cancer, cancer of the bile ducts. That's not very common at all. But if you have that, that can be associated with colon cancer as well. And we look at genetics.
When we consider colorectal cancer, colon cancer or rectal cancer, are they cancers that generally very aggressively get after other organs of the body? Do they spread quickly?
Not if they're caught early. That's just like everything. Some people are afraid to know because they're afraid that if they have this, there's nothing that can be done, and that they're just doomed. And that's not the case at all. Just like all colon cancers, if we catch them at polyp size, you can have a colonoscopy and have them removed. And so we do more aggressive screening to pick things up very early when they're treatable and curable. The vast majority of these can be cured if they're caught early. And that's the key behind early detection and prevention. And if you do have a familial history of colorectal cancer, or really, I encourage if you have a family history of any cancer, because a lot of these cancers are linked on these genes, then you should really talk to your doctor about, do I need more early and more aggressive screening?
Yeah. Okay. So when somebody comes in and you're talking with them and getting their history and finding out that they have this, and you say, this is someone I really want to use genetics to help me understand what's going on within their body. That's not a complicated process for the patient. From that patient standpoint, right?
Not at all. The vast majority of insurance companies cover this now because they want to catch things early. It's actually less expensive for insurance companies to prevent cancer than to pay for the treatment of cancer. And so they want to catch these things early. So, when I come in, for instance, I often see them after they've had their diagnosis. They're sent to me because they have a colon cancer and they need surgery. And so we start talking about family history. And right there in the office, we do genetic testing. And, as you know, I've been doing genetic testing for, I keep saying 15 years. It's longer than that now. But I do it right there in the office when we pick this up. And the good news is that my partner, Dr. Bill Amoria, now she doesn't do colon cancer, but she does breast. She also does genetic counseling now, too. She just became a certified in genetic counseling as well. But when I'm talking to somebody and they have their family history, I go into not just, did anybody else in your family have colon cancer? I say, ovarian cancer, endometrial cancer, stomach cancer, pancreatic cancer, biliary cancer, kidney cancer, adrenal cancer. All those are linked to colon cancer. And if there's any history of that, and I think I've left a couple out because it's a vast number of tumors that can be related on different genes. There's a whole bunch of different genes for colorectal cancer, a whole bunch of different names for syndromes for genetically related colorectal cancer. The most common being Lynch syndrome, and that's called a non-hereditary or non-polyposis hereditary colorectal cancer syndrome. And that's linked to a number of different other cancers. So the history of any other cancers in your family with one person with colon cancer should raise flags that, hey, maybe I need to be tested.
Yeah, and that connection, basically, it's from the neck to the legs.
Right.
Everything in between. All of those can be related to one another.
Right. And, we still, 80% of cancers that we diagnose do not have a known genetic connection right now. But that number is growing as the technology and the knowledge of genetics grows too. And even if you have, the other thing with colon cancer, if I'm seeing you in the office, they do a biopsy. If you're missing one, or if you have a mutation in one of these genes, it won't be expressed on the surface of the cell. And we call that a mismatch. And so when I get the pathology report before ever having surgery, I'm looking at these 4 genes that are associated with Lynch syndrome. It's MSH1, MLH6, PMS2, and one other one that's slipping my mind right now. But if one of those is not represented, then that raises the possibility, hey, from the biopsy, I can tell that this might have a genetic component. And so that's an advancement that we didn't used to do. And so then we would do genetic testing as well. And genetic testing isn't going to the lab and getting a blood draw anymore. We can get it from your saliva. So that day, if you haven't eaten or drank in 2 hours, we can have you spit in a test tube and send it off and get your genetic testing done.
Wow. Do you see the day when someone who's, in their, a toddler or even an infant, where you do that simple test on them and it predicts genetically what they're predisposed for, and therefore you can monitor that and watch that as that child grows into an adult?
Yeah, that day, that could be done now, if we wanted to, but I don't want to scare people because most of these things don't show up till a little later in life. Now there are some, there's some childhood colorectal diseases out there that we test for earlier, if there's a family history. So we're already doing that for some of these. There's a juvenile polyposis syndrome where like it sounds, kids get polyps and then they lead to cancer. If we have a strong family history of colorectal cancer, we do testing. And if there's that gene is found, then we recommend very early interventions.
Yeah. Well, that's the fascinating thing to me is, as you said earlier in this conversation, if we get it early,
right,
then we have a very, very, very good chance that it's not going to affect your overall life picture all that much, that we can take care of it and out it comes and we can move forward with a very, very productive life. And that's the goal of it all.
Right.
Of course, if you do not get it early, catch the cancer early, then that complicates matters more. They come to see you. The surgery takes place. The treatments that follow up. But that's another thing where, as you have said in the past, even where colon cancer has occurred, when we get after it and we get that taken care of, the odds improve, markedly, and for the rest of your life.
Right. And as you know, we've gone over the treatment is so much better nowadays. You were talking to Dr. Mukamala, one of our medical oncologists at the Hillman Cancer Center at IRMC. And, they're using immunotherapy. And one thing that they do is they actually test the cancer itself for multiple genes. And if there's a gene found in the cancer, they refer them back to me to say, is this an acquired gene in this cancer, or is this a gene mutation that is what we call somatic or inherited? And then I go ahead and do genetic testing even on patients that, I didn't see for their surgery. And we find out if they had a genetic mutation that put them at risk for this. One of the main things is that most people don't know their own family cancer history. It's not something you sit around the Thanksgiving table talking about. I encourage people to get out there and find out, what family cancer history there is. How old was Uncle Joe when he had colon cancer, or how old was your Aunt Betty when she had pancreatic cancer, and things, because that's the main thing is people don't realize. They come in and I start asking them about their family history of cancers. And, it's not something that people tend to talk about a lot. And I encourage people to get that information.
Dr. Dan Clark with us here this morning. We're talking about colorectal cancer. We're wrapping up our series of visits upon colorectal cancer here in the month of March. Think back 10 years within the medical industry, and I know that you weren't here 10 years ago at IRMC, but you have actually had been here for...
It'll be 7 years.
A few years. The whole treatment protocol at IRMC when it comes to colorectal cancer, the relationship with Hillman, and the way that you all work together as a team to attack this problem, to me that interconnectivity between all of the different people who are fighting this battle,
Right.
It really, really is inspiring just to see that the way that IRMC is approaching it.
Right. And, to IRMC's behest, we've talked how we were the first nationally certified breast cancer center in Western PA, from Harrisburg to Cleveland, before any of the other major institutions. Well, we're also that same institution that certified the breast center. They've been certifying cancer centers for a long time. And it's the American College of Surgeons Commission on Cancer. And you put your same information out. It has to undergo this vigorous review, looks at all aspects of cancer care. And we were just recently recertified, by the Commission on Cancer as a nationally certified cancer center with everything we have here. So our cancer treatment in general, but the most common cancers we see are colorectal and breast, and we see other cancers as well, prostate and kidney and things like that. We see uterine cancers, but we meet and beat all the national standards that you get at any major cancer center across the country. And a lot of that has to do with our affiliation with the Hillman Cancer Center. Any protocols or treatments that are available in Pittsburgh at the main branch of the Hillman Cancer Center, we have a research advocate at our branch here looks to see if any patient qualifies for any ongoing studies that throughout Hillman. So, you don't have to go downtown to find out if you are getting the latest treatment at Hillman, because it's looked into here.
Yeah. So. All right. So it starts with your visit to your primary care physician, but you need to get that colonoscopy. You need to do everything you can to prevent what is a very deadly cancer, a very common cancer, but a very beatable cancer.
Right. And of course, the one other thing to mention is that if you do need surgery, as you know, we have one of the premier robotic programs in the state, and I'm very proud to say that. And nowadays, if you have your colon out, you spend 1 to 2 days in the hospital typically. And that's compared to the old times when they did the open surgery. You would spend up to 2 weeks in the hospital, and you'd have a 6-month recovery. Now you walk into my office 2 weeks, not 2 months, 2 weeks after surgery, and you're functioning pretty close back to normal after having a major colon resection because of the advancement with the minimally invasive approach and the robotics.
Yeah. He's Dr. Dan Clark. Thanks so much for this month. We appreciate it.
One other thing to remind everybody, tonight we have the after hours event with the Chamber of Commerce here in Indiana. We're going to have the robot over at the Hilton, and we're going to have kind of a mix and mingle. Going to have some hors d'oeuvres over there, and you can test drive the robot to see what we use in the operating room, and come and meet all the people involved, the gastroenterologists, the surgeons, and come talk with us and meet and mingle with the Chamber of Commerce tonight at 5:30 over at the Hilton.
Beautiful. Thanks so much.
Okay.
He's Dr. Dan Clark. It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, WCCSradio.com. Boomer Sports next.
31 degrees in Indiana. Good morning. I'm Matt Lewis on WCCS 101.1 FM, AM 1160, and WCCSradio.com. 8:30 on this 26th day of March, 2025. The River Valley School Board last night approved bids for air conditioning projects at the district's 2 elementary schools. The cost of the projects at Blairsville and Salzburg Elementaries will not exceed $2 million. Board President Rick Harper said during the meeting that the equipment will be easy to work with if repairs need to be made. The project will be performed by Huckestein Mechanical out of Pittsburgh. Most of the work will be done this summer, but Harper said it will not be done in time for the 2025-26 school year. It will be ready after additional work for the following year. The status on the River Valley Stadium Fieldhouse was also discussed at last night's meeting. While the recent bad weather has delayed things by 3 days, the foundation is being worked on, and Harper said that the skeleton of the building is expected to go up in the next 3 weeks. PennDOT is encouraging people to take part in their upcoming 2025 Pick Up Pennsylvania Litter Cleanup Initiative. The program is a cooperative effort between the State Transportation Agency, the State Department of Environmental Protection, and Keep Pennsylvania Beautiful. In 2024, over 77,000 took part in the program across the state, picking up over 3.2 million pounds of litter, recycling 4.5 million pounds of materials, and over 14,000 trees, flowers, and other plants were put in place. To register a Pickup PA event, you can log on to Keep Pennsylvania Beautiful website. We have the link embedded in this story at WCCSradio.com. Events registered between now and May 31st are eligible for free work gloves, safety vests, and trash bags as supplies last. Donated landfill space for trash collected during the cleanup is also available for free or reduced cost between April 1st and April 30th. The Indiana County Commissioners will host a public comment session today concerning the potential Emergency Medical Services Authority. At 10:30 this morning, before the regularly scheduled monthly meeting, the Commissioners will open the floor to the public to comment on the ordinance for the purpose of administering emergency medical services to municipalities in the county. In January, 25 municipalities approved ordinances to form the county-wide authority during 2 nights of public meetings at Homer Center High School, and a few other municipalities have approved their ordinances since that time. The main purpose of the program is to provide a county-wide solution on EMS services on a sustainable basis. The regular commissioners' meeting will follow at the county courthouse. WCCS News Time, 8:33. This news brought to you by Indiana Regional Medical Center. Better health, better life.